Hi, I'm Sharrie Harlin-Davis, program host for Reid Beside You. And today our guest will be from the Orthopedic Walk-In Service at Reid Health. And join us today are our guests Dorothy Lollathin and Matthew Revennaugh, who are both physician assistants at Reid Orthopedics. Welcome.
Thank
And
you.
we always like to introduce and let our audience know how you came to Reid and a little bit about your career history. And we're going to start with Dorothy.
Hello, my name is Dorothy Lollathin. I've been an orthopedic physician assistant for about 16 years. In the past, I worked in Ohio throughout the state. My education was at Kettering College of Medical Arts, and most recently I've come to Richmond to work at Reid for their walk-in clinic. And so far it's been a great success. We've had a lot of positive feedback and folks are happy.
Great. And Matthew?
Yeah, I've been in sports medicine and athletic training early in my career for about 21 years. Decided to go back to school and pursue physician assistant degree. I graduated from the University of St. Francis in Fort Wayne. And I came to Reid specifically to be a part of the orthopedic practice here and do my part in the walk-in clinic alongside Dorothy as my counterpart. Sorry. So I've enjoyed learning about this area and being a part of this community. It's exciting.
And we're happy to have both of you here with us. Explain to our audience what a physician assistant is.
A physician assistant is basically the right hand of the surgeon or the doctor that you're working with. We do about 85% of what the surgeons or the medical doctors can do. They have a hard time without us. They really appreciate the service that we can do. A lot of times people refer to us as physician extenders, which is, I think that's an accurate way to put it as well, that, we extend the services of the physicians or the surgeons at the hospital, at Reid, across the country. We do so much more than people think that we can.
Did you want to add anything, Matthew?
Yeah, I think something that's unique about physician assistants that most people aren't aware of is that our training is advanced medical training, similar to the med school model. We do didactic education process and clinical hands-on process. So that's kind of that dual model, similar to med school. Ours is abbreviated version, basically, of the med school model, and which brings us kind of our insight and knowledge alongside and parallels the surgeons, physicians that we work with, so that we can, like Dorothy said, can be an extension of the services that they can offer.
And we have some infographics that you will see throughout the presentation to review and understand more about the qualifications and what the physician assistants do. So one of the things you did mention earlier was the differences between a PA and a surgeon.
Yeah, so a surgeon would be the one performing the actual surgery, and a physician assistant or a PA, our role is to assist during that time. We don't plan the surgery, we don't design the surgery or decide what specific procedures are going to be performed, but we're very familiar with them, and when we're in the operating room with the surgeon, we are, right at their side, assisting with every step of the process for their sake, to be able to focus on what they're there to do.
And explain the new service that's being offered at Orthopedics.
So it's a walk-in clinic, and starting in June, we're going to be open Monday through Friday from 8 a.m. to 8 p.m. You don't have to have an appointment. That's the beauty of the walk-in clinic. You can come in with various aches and pains of any of the joints, and we can take a look at you and see how we can best take care of you. We also treat acute injuries. Say you have a fall, you think you may have broken something, you can come in and we can check that out. If you just have a busy schedule and you can't make appointments or whatever, but you seem to have some free time and need to come in and have something checked out, we can do that as well. If you have a problem after surgery or questions or anything like that, we're open to help you and anything like that.
And I know on our slide it states from Wednesday to Friday, but we're very excited and already, as you were saying, in June, that those hours will be extended to Monday through Friday.
That is correct.
And explain a great benefit that the service offers. So explain to us what currently happens if you thought you had a problem before the walk-in clinic.
So before the walk-in clinic, if you had a problem, like say, for example, if you had an injury at home and you fell and your knee's bothering you and you feel like you need to see someone, most patients would then have to call their family doctor, go to an urgent care, decide whether they want to go to the emergency room if they felt that it was emergent. They would have to kind of go through a process to get to someone to care for their injury. What this service does, that's the advantage, is you're getting same day service with a specialty clinic that we can get you directly. Sorry, my lights went off. Hold on just a second. We can get you directly connected to specialists such as Dorothy, myself, and access to the surgeons here and their expertise to manage your injury, to manage your problem without that 2, 3, 4 step delay to get to the specialist. And it's really about patient access. It's a convenience for our community to be able to get connected to the right providers that they need for the problems that they have.
And so often you will see, I've seen this, where someone has a problem, they hurt their knee or they twisted their ankle, and then they will say, well, I need to wait a couple days before I can go to ortho. So does this solve that problem?
Yeah, sometimes people will call in because they've seen a provider in the past and, they may be in surgery, that provider may be in surgery or out of the office or so forth. And it may take, because of their busy schedule, it may take a week or two before they can even get onto their schedule. Not all the time, but sometimes. And so the walk-in clinic offers, same day access, like Matthew said. And really the patients just that we've seen so far have just really loved that convenience.
So can you walk me through the process? What can a patient expect when they arrive at the walk-in clinic?
So when they come to the walk-in clinic, they'll register just like if they were seeing any of the other providers. They'll be brought back to our walk-in side, and then we determine whether or not they need imaging, which is usually x-rays. If there's an injury or an acute problem, something that's new, we generally get x-rays. And then once we have that information, they'll see either myself or Matthew, and we'll address the problem that they have, the concerns that they have, and make a treatment plan, whether or not they have to be referred to another provider like the surgeon, or sometimes we have patients that come in that do need surgery for their problem that they're experiencing, and we refer to their surgeon of choice or one of our providers that is available for them.
And Matthew, did you want to add anything?
No, I think she did a good job explaining that. That's exactly what we're here for, is just to make that process fluid for the patient and get them where they need to be and care for the problem.
So that's a really a plus that you have the x-ray capability right there at one location.
Absolutely. And not only that, we have all of the supplies and things, the bracing and the the boots and the splinting and the casting and any of those things that you might need done, we can handle that here. Whereas, like we said before, if you have to kind of, before this walk-in clinic, you had to go to your family doctor who may not have the specialty brace or the type of, splint or cast that you need, and people would come here to do that. And this kind of alleviates a lot of those transitional steps to get direct access to specialists in orthopedics.
I know often when we add various services, it's because of the request, and we've seen the need from the community.
Mm-hmm.
And was that one of the results for when people were requesting this type of service?
I think there was a need, and I think the surgeons and the providers that were there noticed there was a need. If it takes a week or two to get in to see somebody that you've seen in the past or that has, a new problem, your satisfaction goes down because you want something treated now. And, not that we can alleviate all suffering, but a lot of times we can make it a lot better. And so it's needless for you to have to wait, a week, 2 weeks, sometimes 3 weeks, if it's, an acute problem and you're concerned about it. Another thing, we see children there, children's injuries. I think it has a lot to say about peace as a parent when you have your child that's injured, that you can go to, a same day appointment and say, is this something I need to worry about, or is this something that's going to be okay? And a lot of times we can, give a little bit more reassurance, or, start the testing process if there's some other imaging or some other treatment options that we need to address or start with.
And you did mention regarding children. So often, I know, especially in the summertime, you've got a lot of sports injuries, as well as past COVID. As we're getting more and more back out there, you can do that quick, fast, and in a hurry. So that would be a great addition for the community.
Mm-hmm.
So that you don't know about the unknown, as you were saying previously. So what's our ultimate goal for a community and on this particular service?
I think ultimately we want to make it as efficient and accessible as possible. We already are in June extending our hours to 5 days a week, 12 hours, 8 to 8. To have somebody available all day long, and just make it easy for patients who need us to access us, and that I think will bring an element of value to Reid as an organization, but also to the community in general, to become more aware of what we have to offer here, and realize that we have the things we need in this community, and the easier it is for them to be accessible, and the more aware people become of that, I think that's a benefit to everyone.
And you are your office setting is very close to our sports medicine area, so then you can work together.
Absolutely.
We have another thing is the additional hours. So is that to help, especially like our working families, that they can come after 5 o'clock or have a later appointment?
Absolutely. I think when you have the extended hours like that, not only does it help the working parents or the working people, it also helps students that are trying not to miss school and that kind of stuff. I know with COVID, everything's, up in the air and crazy and seems to change week by week, but really the convenience of after hours clinic is, or after traditional hours, which is the 5 to 8. is very convenient for those that are working or trying not to miss work, or have their children that can't miss school and so forth. You mentioned the sports medicine. There is the athletic clinic that is in the Reid Orthopedic building. We work very closely with athletic trainers from all of the local schools and the colleges there. We see lots of athletes that are injured or just have concerns based on their training and so forth. So we really have a good base of patients that come in that are just really appreciative of our service now.
And it's always good to hear a story. Did anyone have a story, a success story that they could share of someone that came into the clinic?
Well, we had a patient that came in. I'm not sure if it was her family provider that told her about her hours, or maybe she had a family member that worked at Reid that encouraged her to come to see us. And the problem she had, we could, alleviate some of her symptoms by giving her an injection. And she stated that she had almost, immediate improvement, and she just really felt like it was a great benefit to her in the community. She even mentioned that it was kind of like, Matthew, what did she say? Something about this was a secret gem or something?
Yeah, secret gem.
That Reid had, and they were so excited to tell their friends and family about. She actually had her husband come in and see me the next day because he had complained about a various problem that we were able to help him with as well.
And those are the type of stories that's always beneficial, and more. So it might not be so much a secret pretty soon. Matthew, did you have a story?
No, that was the one I was thinking of, and I think that's the thing that highlights. We're here for when you need us. The tagline. Reid right beside you. It's like that's what we are. We're right here, right beside you. For whatever you need.
So it's that's great. The another issue. So as we know we're just focusing on the clinic itself, and then how often are you at the hospital? Do you come in and out, or how's that work? Or do you
we
just
work.
transfer?
Our practice, we work as a team.
Okay.
So our role on the team, Dorothy and my role is in the walk-in clinic to be available for one of us to be available every day, all day. And then have surgeons and other physician assistants that work here. We all work together, communicating with one another about various things that are happening, various things, and covering each other for times when, everyone has family obligations and vacation issues and, illness or sickness or whatever. And we all kind of take care of each other and cover each other's back. So that's kind of our role, is to be available to the patients in the walk-in clinic setting, but also to be part of the team with the surgeons and the other PAs here in the clinic.
And so you make it a seamless effort in keeping everyone aware of what's going on, as well as with your patient flow.
Right, exactly.
The other thing how people want to be in contact with you, we have the information on how to contact your location, which is the Orthopedic Walk-In Services. And for people in our viewing area, that's usually the orthopedic area is behind Frickers. That location, you can see it off of 70.
Right next to the water tower.
Great. We want to thank you both for joining us today. So, and I'm sure that you won't be a secret, and soon people will know how to get in touch with you both. And we want to thank you both, Dorothy and Matthew, for joining us today on Reid Beside You.
Thank you so much.
Thank you. My pleasure.